How you feeling, Mayor?
Unmute. Hi, everybody.
Thank you for asking. Cold symptoms, some pressure in my chest. You know, this is a beast, this thing. But I'm not incapacitated, fortunately.
You look pretty well, though.
Thank you.
Yeah.
We ladies have an advantage. Little makeup.
Hope you get better soon.
Thank you so much. Well, hopefully I'll be out and about by Wednesday.
Okay, good.
I like the way all these guys put ties on today.
Hi, Steve. It's Charles. Can you hear me?
Hey, Charles.
All right. Good to see you.
Good to
Hi,
see you.
Mayor. This is Charles Gressley with HCA Healthcare. Pleasure to be with you today.
Thank you so much. Thank you to everyone. This is very impressive. We have a great group with us today.
And some people are even showing their faces, like Charles. He never shows his face.
It's a first.
Well, hey, technology, right? We're on this WebEx platform, and so we don't know how to tap into Zoom, but we do today.
Sorry.
So.
Very good.
Mayor, good to see you and see you getting better.
Thank you.
I am here with my chief of staff. That's why I have my mask on, because we have other meetings after.
Excellent. And thank you so much for joining us. And I look forward to your words today as well.
Thanks to you.
Great. I think we're going to go ahead and get started because we have a pretty full speaker list. So before we begin, I'll just quickly run through the program order. First, Mayor Daniella Levine Cava will introduce the press call with remarks in English and Spanish, followed by Acting Chairwoman Rebecca Sosa. Next, we'll hear from Monroe County Mayor and County Administrator Michelle Calderon and Roman Gustesi, Commissioner Mark Bernard from Palm Beach County, Miami-Dade's Chief Medical Officer, Dr. Peter Page, Jackson Health President and CEO Carlos Magoya, Health System COO, Dr. Deepan Parekh, Baptist Health COO and Executive Vice President Bo Bollinger, Nicholas Children's President and CEO Matthew Love, Mount Sinai Medical Center President and CEO Steven Sonnenreich, Florida Medical Center and Miami-Dade Group Tenant CEO Jeff Welch, Memorial Healthcare System CEO Aurelio Fernandez, and finally, Broward Health Chief of Emergency Medicine, Dr. Evan Boyer. Not presenting on the call, but also joining us today are HCA Division President Charles Gressley and Dr. Carla McWilliams, Chief Quality and Safety Officer for Cleveland Clinic Weston. And then we'll take questions from the media. Again, as usual, please just put your hands up in the Zoom and we'll try to get to as many questions as we can. And then we'll have a translation from our Creole translator to close us out. So thanks again to you all for being here, and I'll hand it over to Mayor Levine Cava.
Thank you very much, Rachel. Thank you everyone for being on this call. And we do have quite a few speakers, but that's because we're regional and that's because the topic is so critically important. We're joined today by our healthcare leaders, our elected leaders from across the entire South Florida region. That's Miami-Dade, Monroe, Broward, Palm Beach. And we want to give a special thanks to the chiefs of our outstanding area hospital network, our Chief Medical Officer, Dr. Peter Page at Jackson, our Miami-Dade County Commissioners who've joined us, many city mayors who have joined us. Thank you, mayors. And to my colleague, Monroe County Mayor Coldiron, for joining us as well. So we're gathered virtually together as leaders representing all corners of our region to share an urgent and united message that our entire regional community shares, and we need to work together. Coronavirus cases are on the rise, and we must take this extremely seriously. We're gravely concerned about overwhelming our healthcare system capacity to care for COVID patients. Our hospital network in South Florida is one of the finest in the country and has done extremely well at dealing with this pandemic. But if we push our system to the limit, when COVID cases spread too quickly, we will be at a breaking point. So that is why it is essential that we all take steps in our own lives to protect our families and to protect our healthcare workers and first responders, those who are on the front lines every single day fighting this virus for us. It's not just for ourselves, it's not just for our families that we need to stay safe, it's for the families of the thousands of healthcare workers, firefighters, and police who are not just taking care of their own lives, but of all of our lives, protecting us and keeping our loved ones safe. And you all know I have contracted the virus as well. My husband is a physician and was exposed through a patient. So the good news is that we all know what to do. After 9 months of living with this dreadful disease, we all know we must wear a mask. We must practice social distance. We must wash our hands and sanitize, test, trace, and isolate. And especially during the holiday season coming now, it's key that we take advantage of our beautiful weather, of our beautiful outdoor activities, and we spend time in our parks and open spaces. In the next few weeks, what we do will be critical to determining how we get control of this disease, whether we overwhelm our healthcare system, and how we keep our economy moving forward. So my message to our community is hope is on the horizon. A vaccine is coming within the next couple of weeks, and Jackson and Memorial will be at the front lines with the distribution to our healthcare workers. And to get to the other side of this pandemic, we cannot let our guard down now. We need to stand strong as a community, committed to following public health protocols so that we can keep moving forward in the new year. I know that it isn't easy. We all have COVID fatigue, but it is why we need to share one united message, uplift and celebrate everyone who is doing what is needed to keep all of us safe. So next week, my administration will be rolling out a new messaging campaign for the holidays aimed at amplifying the steps we can all take to contain the spread and celebrating the businesses and the community members that are going above and beyond to protect each of us. And I'll continue to work hand in hand with our county leaders, with our League of Cities, with whose executive board I met this morning, with our city mayors, our business leaders, our healthcare experts, to get this campaign out into the community and speak with one voice to our residents about the urgency of the crisis we face. So I'm so grateful that we have these leaders on the call with us. You'll hear from them soon. Stay strong, stay safe. Thank you and God bless. Y ahora un poquito en español. Gracias a todos por estar en esta llamada. Hoy nos acompañan virtualmente los líderes de la salud de los hospitales y funcionarios electos del sur de Florida, que comprende los condados de Miami-Dade, Broward, Palm Beach y Monroe. Hoy queremos dar un mensaje urgente y de unidad. Nos preocupa sobrepasar la capacidad de nuestro sistema de salud para atender a los pacientes con COVID. Nuestra red de hospitales en el sur de Florida es uno de los mejores en el país, pero ponemos nuestro sistema al límite cuando los casos de COVID se propagan demasiado rápido. Por ello es esencial que sigamos tomando las medidas necesarias para protegernos y a nuestras familias y a las familias de los miles de trabajadores de la salud, bomberos y los policías. Necesitamos comprometernos como comunidad a seguir los protocolos de salud pública para que nuestro condado y nuestra economía sigan en marcha. Le insto a que sigan tomando las medidas de seguridad que sabemos funcionan para detener esta pandemia. Usen una máscara, practiquen la distancia social, lávense las manos y desinfecten. Y durante estos días festivos aprovechamos nuestra hermosa naturaleza para disfrutar de actividades al aire libre y pasar tiempo en nuestros parques y espacios abiertos de manera segura. Mi mensaje para nuestra comunidad es: la esperanza está cerca. Se acerca una vacuna, pero no podemos bajar la guardia. La próxima semana, mi administración lanzará una nueva campaña de mensajes para las fiestas con el objeto de ampliar los pasos que todos podemos tomar para contener la pandemia. Sigamos manteniéndonos fuertes y seguros. Gracias y Dios los bendiga.
Great. Thanks, Mayor. And next we'll hear from Acting Chairwoman Rebecca Sosa.
Thank you, Rachel, and thank you so much, Mayor Levine Cava, for bringing us all together, Palm Beach, Broward, Monroe. This is so important. I am honored to be able to represent my colleagues in the Board of County Commissioners today to communicate with the community. My hat off to all the healthcare workers that are placing their life at risk at this point. I believe that the numbers never lie. They're there. The increasing amount of numbers, having, for example, in Miami-Dade County, more than 2,000 per day is too much, and the other counties are facing the same thing. Keeping the businesses open will depend on what we do, and we need to keep the businesses open for the community. But there's no business open if the numbers continue to grow the way they are. So I think that we need some ability to enforce rules that can make it safer for those workers and for those at home, the grandparents, the parents, the children. So we have hope at the end of the tunnel with the vaccine. But in the meantime, maybe regulations need to be more strict, because if not, then we're going to continue having families that are suffering at this point. Yo creo que le tengo que dar las gracias a la alcaldesa Levine Cava por unirnos a todos, el condado de Palm Beach, Broward, Monroe, y todos unidos en un mensaje con aquellos que están exponiendo su vida en los hospitales, nuestros bomberos y nuestros policías también, cada día su vida. La salud es muy importante. No podemos mantener los negocios floreciendo para que las personas puedan pagar sus rentas y puedan pagar sus necesidades si no existe la salud en las familias. I had one city in my district that had to close City Hall. Yo tengo una ciudad en mi distrito que tuvo que cerrar las puertas de servicio por el número de casos. Quiere decir que si no podemos enforzar reglas para que las personas se cuiden, esos números van a seguir aumentando. Y eso es una preocupación. I really thank you all, and thank you, Madam Mayor, because I think that we need to realize and tell the people that it's not over, that it's worse than ever, and that we need to take care of ourselves. And by taking care of ourselves, we're taking care of others. So thank you very much to all of you, and I am so happy to see so many faces that I haven't seen in so many years. Thank you. Gracias mil.
Thanks, Madam Chair. Next, we'll hear from Monroe County Mayor Michelle Cold Iron, who's on the call.
Hello, and thank you so much, Mayor Levine Cava, for including the Keys in this discussion today. You know, we're very unique here in the fabulous Florida Keys. We are a chain of islands. We're connected by 42 bridges. Living in paradise, however, does come at a cost. We therefore do depend upon the mainland, Miami-Dade, for a vast amount of our resources. For example, our county, we only have 3 tiny hospitals with a combination of 200 beds, 20 ICU beds, and approximately 15 to 20 ventilators. While small, our hospitals are backed by their corporations, Baptist and community health systems, and we do rely on that larger network. Our economy, our community, and our healthcare truly are interconnected with Miami-Dade, and it is imperative for us to continue to engage in these open communications and collaboration with you, Mayor Levine Cava, and all of your partners, including the CEOs of the hospitals here today. So thank you again for including us, and we will keep up our part on our chain of islands with our messages of wearing masks, of socially distancing, of washing your hands, of staying in small groups. So with that, I'll kick it over to my administrator if he would like to add a few words.
Not really. Rachel gave me the fear of God to keep it to 1 minute, so we combine our comments. So thank you for that. But I see a lot of familiar faces. Hello, everybody, and keep saving your money. When this is all over, please come down and spend it down here because we're going to need it. So good seeing everybody.
Great. Thanks to you both. And next we'll hear from Commissioner Mac Bernard, who's with us from Palm Beach County.
Thank you very much. This is County Commissioner Mac Bernard in Palm Beach County. Palm Beach County, we have over 1.5 million residents that call Palm Beach County their home. I want to thank Mayor Cava for arranging this conference call because it's so important for us to continue to communicate to the public on the impact of COVID-19. We have Dr. Alonso, who's also in the room with me. We're at the Emergency Operations Center with our director, Bill Johnson, also our county administrator, Virginia Baker, who's also here. She's on the Zoom call. As of this morning, the overall hospital bed in Palm Beach County, the utilization rate is over 75.54%. The overall ICU bed utilization rate is at 71.14%. And the total ventilator utilization rate in Palm Beach County is at 43.88%. Our latest COVID numbers, 5% of our county beds are occupied by COVID patients, which has been constantly just above or just below this 5% over the last 14 days. Hospitalization rate in Palm Beach County has been increasing since mid-October, where we average 286 COVID patients a day, up from 111 patients per day countywide since October. 17% of our county ICU beds occupied by COVID patients, and in the last 2 weeks has been as high as 18.3% and as low as 12.4% in ICU bed hospitalization rate. Average 68 COVID patients per day, up from 24 COVID patients per day. Our Division of Emergency Management has had weekly conference calls with our hospitals just to make sure that we're keeping in contact with all the hospitals. These weekly calls has been going on since September. The last call was on 12/3, and the situation in Palm Beach County is manageable, and staffing, of course, is an issue and could impact hospitals' capabilities in the near future. And nationwide shortages in terms of RNs and respiratory therapists are also something that we're monitoring very closely. And so we're constantly communicating with our hospitals to make sure that we're handling the situation in Palm Beach County. As Mayor Cava stated, we have to speak in one voice. This is Union 7. This is in regards to Dade, Broward, Palm Beach, and Monroe County that we have to work together. And, just to make sure for the Haitian speakers, who are listening, l'union fait la force. Faut que nous travaillons ensemble pour nous make sure que nous régler tout bagaille COVID-19. And in Spanish, estamos todos unidos. Thank you very much. Thanks for having me.
Thank you so much. And I'm just going to step in for a moment to say that while we're not represented by our elected officials in Broward, they're very much working with us. Mayor Geller was not available, but in fact, I passed the torch to him as chair of the South Florida Regional Planning Council when I stepped away from the County Commission. And of course, we will continue to work closely as well. We have representation from hospitals, and which we'll hear from shortly in Broward. So it is so critical that we work together across the region. We know that people are crossing county lines constantly for work, for medical care, for education, and so on. And it's great that we're all working together. Thank you.
Great, thanks, Mayor. So next we'll hear from all our hospital leaders, beginning with Miami-Dade's Chief Medical Officer, Dr. Peter Page.
Good morning, everyone, and thanks for having me. Looking forward to the ongoing discussions. I did want to start off with re-emphasizing some of the bad news that has been already mentioned. Unfortunately, the numbers continue to head in the wrong direction. Positivity rates across Miami-Dade County continue to increase, and that obviously is indicative of community spread. Just some numbers for reference. 60 days ago, countywide, our positivity rate was 5.11%. Yesterday, the positivity rate was 9.77% for COVID positive cases testing. That is a 91% increase in 60 days. 60 days ago, countywide, our hospitalizations for COVID positive patients were 341. Yesterday, the number was 815. That's a 139% increase. And 60 days ago, countywide, our ICU census for COVID positive patients was 104. Yesterday it was 164, a 58% increase. This is particularly concerning, considering we really don't know that the most challenging days may still be ahead of us. We're at this point now, but it's even more critical at this point to prepare for the future. And people really need to follow the strict guidelines that we've talked about, around preventive measures that have proven successful in decreasing the spread of this virus. Some of those measures, obviously face masking to cover both your mouth and your nose. We talk a lot about hand hygiene. We need to regularly wash our hands, soap and water, hand sanitizers. We should be sanitizing surfaces as regularly as possible. All of these things are going to contribute to our reduction in the spread of this virus. We talk about social distancing, maintaining 6 feet of distance between yourself and others. We talk about avoiding crowds and gatherings. And if you are in a group, try to make it outside if there's nothing else you can do to avoid the contact. And I want to put out a message. Particular caution has to be paid by our high-risk populations. The elderly, those with pre-existing conditions, are more vulnerable and more susceptible to this infection and the severity of the infection, and really paying attention to individual social distancing, especially with people who aren't wearing masks. The last thing I'm going to mention, obviously it's the holiday season, a very challenging time. The CDC has recommended against travel in an effort to try to decrease the spread of this virus. Unfortunately, as we all know, over Thanksgiving or that holiday stretch, we had some of the busiest travel days of the year, which obviously is of concern as we continue to progress through the holiday season. We fully anticipate our number of positive cases are going to increase over the next couple of weeks, based largely on the travel over Thanksgiving, as well as the gathering, family and friends. This is of particular concern to our community's hospitals, especially with Hanukkah, Christmas, and New Year's right around the corner. The best thing we can do is to postpone all travel and stay home over the holidays and stay safe. If we choose not to follow that plan and continue to move forward with travel against the CDC's warnings, the recommendation from the agency is that we get tested. The testing process for COVID would be 1 to 3 days before travel, 3 to 5 days after travel. And the further recommendation is that for 7 days following travel, we essentially reduce non-essential activities. If you choose not to get tested, the reduction of non-essential activities increases to 10 days. And obviously, if you test positive, you shouldn't travel. Really important for people to understand, especially our youngest population or our younger population, is that you can be infected with COVID and have no symptoms. In a place like Miami, this is particularly concerning, considering all the multi-generational households we have throughout the city. I always want to remind people we have multiple free testing sites across the county. Oftentimes the results will be back within 24 to 48 hours. Please utilize those resources, as needed. And, really my plea now at this point is, we really need the public to do their part in helping our community, stop the spread of this virus. It's really on us, it's our responsibility, and I encourage all to take it seriously. So thank you very much for your time.
Thanks, Dr. Page. And next we'll hear from Mr. Magoya of Jackson Health as well.
Good morning, and thanks to Mayor Levine Cava for bringing us all together at this crucial moment in the pandemic. Clearly, we have a long winter ahead of us, but there is a light at the end of the tunnel. We found out a couple of weeks ago that Jackson Health System and Memorial Health System will be the first organizations in South Florida to receive the first vaccine approved for emergency use, which is Pfizer version. Since then, we've been working around the clock to make sure our facilities and our people are ready. In that last day or two, we've been talking with our partners in Governor DeSantis' administration about supporting an even broader vaccine rollout. It appears that we will now receive enough of the Pfizer vaccine this month to support inoculation of all frontline hospital workers in South Florida who meet the FDA's criteria. Our preliminary understanding is this will include all hospital employees who come in directly contact with COVID patients. That's not just doctors and nurses in the emergency rooms and COVID units. It potentially includes a huge team of patient technicians, therapists, and other support team members. This is evolving incredibly quickly, and we're in constant contact with the FDA, CDC, and state officials. We are not ready yet to discuss the logistics of that. This is a massive undertaking, and we need to do some quick work with our hospital systems on this call to make it as efficient as possible. This is the bottom line. By the end of December, we could be on our way to overwhelmingly ensuring the safety of all our frontline caregivers. That is still a long, long way from the herd immunity or the end of the pandemic. But it's crucial to getting through the next phase of COVID, because we learned over the summer that our staff are not only the most precious resource, but also the most scarce. Our community cannot afford to have even a small share of our nurses and doctors catching this disease. Let me also remind you, as I'm sure everyone else on this meeting will, that vaccines are not going to end this pandemic overnight. As you all know, the Pfizer vaccine requires 2 doses, 3 weeks apart, and then approximately 2 more weeks after to develop immunity. It might be spring before the general public can even get access to that first dose. Masks, hand hygiene, and social distancing are going to remain absolutely vital to our protection for a long time to come. We have lost too many of our neighbors to this disease, too many fathers and mothers, too many daughters and sons. Each life we have lost since this began in March is a tragedy. Now that the end is in sight, and now that we know so much more about how to stay safe, we should be ashamed to lose anyone else. If you want to honor the nurses and doctors and all other healthcare heroes, please hold the line just a little bit longer. The cavalry is coming, and we need everyone to dig in until it is done. Thank you.
Thank you. Next up, UM Health System COO, Dr. Deepan Parekh.
Is he not going to speak in Spanish, Migoya?
Yes, please.
Please. Yes,
If you're
thank you.
I'm happy to do so. Let me get my talking points in the right direction again. Thanks for doing that, Adriana. Primero que nada, quiero darle las gracias a la alcaldesa Cava por reunirnos todos aquí en este momento que es muy importante en el nivel crucial que tenemos en la pandemia. Definitivamente vamos a tener un invierno bastante largo adelante de nosotros, pero sí tenemos todavía un gran esperanza de lo que tenemos adelante. Hemos entendido en los últimos par de semanas que el sistema Jackson en Miami-Dade y el sistema Memorial en Broward van a ser los primeros hospitales en el sur de la Florida que van a recibir la primera vacuna aprobada para uso de emergencia. Esta es la versión Pfizer. Desde entonces hemos estado trabajando con todas las facilidades posibles para mantener las personas de toda la empleomanía lista para dar esta clase de vacuna. En los últimos 2 días hemos recibido notificación de nuestros socios en la oficina del gobernador DeSantis que vamos a tener hasta más vacunas para estar seguros de que podemos tener suficiente vacuna Pfizer este mes para inocular a todos los empleados de hospitales en el sur de la Florida, que obviamente tengan la criteria del FDA. Nuestro entendimiento en este momento es que todos los empleados que van a estar directamente en contacto con COVID o pacientes de COVID, no solamente los médicos y enfermeros y salones de emergencia, sino también van a incluir el equipo de técnicos, terapistas y otras clases de empleados que tengan posibilidad de ir indirectamente contacto con pacientes de COVID, van a tener la posibilidad de tener esta vacuna. Esto se ha envuelto bastante rápido y estamos en contacto constantemente con el FDA, el CDC y los oficiales del Estado para estar seguros que tengamos la más última información sobre esto. Todavía no estamos listos para terminar la logística que estamos hablando sobre esto, pero sí es una logística bien grande lo que estamos tratando de hacer y estamos en este momento hablando con todos los otros hospitales en el sur de la Florida para estar seguros de hacerlo lo más eficiente posible. Lo más importante de todo es que para finales de diciembre vamos a tener todos los empleados que están impactados con esta clase de pandemia en los hospitales vacunados para COVID o esos que quieran ser vacunados. Todavía esto es un camino bastante largo para poder conseguir esa clase de inmunidad social que estamos hablando. Pero es crucial que también que llevemos a esto al próximo nivel de COVID, porque hemos aprendido mucho este verano de cómo poder cuidar sobre esta pandemia. Y hemos también aprendido que el recurso más importante de todo, lo más precioso, es nuestra empleomanía y también la más escasa. Y por eso no podemos tener ni quisiera un enfermero o ningún médico enfermo en ningún momento por esta clase de enfermedad, sino tenemos que tenerlos todos para poder cubrir la clase de necesidades que vamos a tener con los pacientes. Déjame dejarles saber que lo importante de aquí que esta vacuna no va a terminar esta pandemia inmediatamente. Como ustedes saben, la vacuna Pfizer requiere 2 dosis, 3 semanas aparte una de la otra, y después 2 semanas adicionales para desarrollar la inmunidad. Posiblemente hasta la primavera, la mayoría del público general no va a poder recibir acceso a esta primera dosis. Así que, mientras tanto, las mascarillas, higiene de manos y distancia social son extremadamente vital para estar seguros de protegernos para el plazo largo. Llevamos demasiado tiempo perdiendo vecinos a esta enfermedad, padres, madres, hijos, hijas. Cada vez que perdemos una vida desde marzo es una tragedia. Y por eso no podemos perder la vista en este momento, que tenemos que estar lo más precaviendo lo más posible para estar seguros de no perder una vida más. Y por eso, si quieren honrar a los enfermeros y los doctores que tenemos en todo lo que es el sur de la Florida, por favor, mantengan firme esta posibilidad un poco de tiempo más, que estamos con la caballería en camino y estaremos pronto teniendo la vacuna para protegernos a todos. Así que muchísimas gracias.
Gracias.
Great, thank you. Now I'll hand it to Dr. Deepan Prek from UHealth. And just a quick reminder to everyone to please speak for just a couple minutes. Make sure we have some time for questions at the end of the call. Thanks, Dr. Prek.
Thank you so much. Thank you, Mayor Levine Cava and distinguished colleagues for coming together virtually today to talk about this extremely important topic. Our battle against COVID-19 continues, and in fact, it intensifies every day during the current surge in cases. A big milestone in this battle will be the arrival of a vaccine. The University of Miami health system has been working long and hard, as have all of our South Florida health systems, to prepare for it. I'm proud to say that researchers at the University of Miami Miller School of Medicine have conducted clinical trials for the Moderna vaccine and are currently conducting trials for the Janssen vaccine. We are deeply grateful to the people who agreed to participate in these very important trials. That research must continue at our health system and many others, because the community and the world will need more vaccines moving forward. We also continue to work to develop new treatments for COVID-19 and new ways to deliver drugs to suppress this virus. The university has conducted research on the monoclonal antibody drug with Regeneron, which has received an emergency use authorization from the FDA to help treat selected patients and prevent the spread of COVID. Another investigational medicine, bamlanivimab, is used for the treatment of COVID-19 patients with mild to moderate symptoms who are at high risk for developing severe symptoms. It's also available to patients through emergency use authorization. As more and more members of our community receive the vaccines in the coming year, we will continue to make significant progress in reducing the spread of COVID. In the meantime, it is critically important that everyone remain vigilant about safety measures to minimize the spread, as underlined by both Carlos and Peter. At the risk of repeating, I would still emphasize on the fact of wearing a mask at all times in public, staying at least 6 feet away from other people, wash your hands and practice hand hygiene frequently, try and avoid large groups of people and clustering, strongly discourage travel as Peter highlighted. And I just want to reiterate that all of us at South Florida's exceptional healthcare systems are working together and collaboratively to protect our community. Thanks to my colleagues for your partnership in this battle. Thanks to our frontline team for their commitment to their patients and each other. And we wish you a very speedy recovery, Mayor Levine Cava. Thank you very much.
Thank you. Next is Baptist Health COO and Executive Vice President Bill Bollinger.
Good afternoon. It's a pleasure to be here. And thank you, Mayor, for pulling all of us together again today. This pandemic has highlighted the strong collaboration between local healthcare organizations and our local governments. Today's another example, but we've actually been talking at least weekly ever since March. The last 9 months have presented unprecedented challenges for the healthcare providers in the communities we serve, the 4 counties of South Florida. And we understand that the decisions that we make related to care touch and change so many lives in the community. COVID-19 has only heightened our already profound responsibility to care for the community. In Monroe County, as you've heard, we've been very fortunate, and the number of COVID cases remain low. We did see some peaks in July and August this summer, but we're hopeful that the case count remains low in the Keys. In Miami-Dade and Palm Beach County, we've seen the number of COVID cases steadily increase for the last 4 weeks. In Palm Beach County at Boca Raton Community Hospital, Bethesda East and Bethesda West, we've seen gradual increase, but our numbers up there remain manageable and we're closely monitoring the trends. All of our hospitals are very busy, as hospitals tend to be this time of the year, but fortunately, it's a manageable situation for now. For Baptist Health, with 11 hospitals in the 4-county area, we have the ability to move patients around as needed, as we have done over the summer. Across our organization, from Monroe to Palm Beach County, our focus has been the same: to lead with science, to prepare, protect, educate, and of course, to provide the highest level of compassionate care. If not for the support from our local government leaders, this already challenging situation would have been much more difficult to navigate, and we thank our leaders. We've learned a lot. Clinically, we're better prepared now than we were a few months ago, as you heard from our physicians. We have much better therapies, we have stronger evidence for treatment protocols, and we're more knowledgeable about how to protect ourselves within healthcare organizations. But there are limits to our resources, and that is why we are all gathered here today. Amidst this other surge, we find ourselves in this same familiar spot, but one through preparation and experience and sound public responsibility, we can persevere through this together. We're optimistic about the reports about the vaccine. However, it's very important to note that we can't drop our guard. We must continue to act responsibly and remember how we behave in the community directly impacts the health and safety of our frontline caregivers, family, and friends. We're all incredibly proud of our healthcare heroes, and we've all witnessed exceptional selflessness and resilience from them, who at every turn have put the well-being of the patients before themselves while having to stand long hours of physical and emotional exhaustion. Let's continue to honor them by doing the right thing, wearing masks, socially distancing, and work together to beat this disease in our community. So what we ask you to do today is be positive and hopeful, stand together, protect our healthcare heroes, our doctors and technicians and nurses, and those at high risk in the community. There's a light at the end of the tunnel. We're almost there. Thank you and God bless.
Thank you. Next up is Nicholas Children's Health System President and CEO, Matthew Love.
Thank you. It's great to be here. Good to see you, Mayor, and a good neighbor, friend, and Commissioner Sosa. So thank you for having us. I'll just start by saying, I would like to also thank the hospital partners here. What we've seen over the last couple of months between what formerly were competing health systems coming together for the community for all the right reasons, for our caregivers, our physicians, and for our community has been nothing but been fantastic. In the pediatric world, it is a little different, thankfully. We continue to see trends in terms of increasing number of cases through the summer months. It has decreased recently over the last several months. Across the nation, at the end of last month, there was about, the American Academy of Pediatrics had about 1.3 million cases of a positive and pediatric population. Here in Florida, that's about, translates to about 92,000 kids who have tested positive and about 20,000 here in Miami-Dade County. Fortunately, the positivity rate is less here in Florida in kids compared to other states across the country. We continue to see good news related to our state in pediatrics versus some of the other states across the country. Since March, Nicholas Children's, we've admitted just under 400 kids, and fortunately, most of them have done well. Those children that do become infected with COVID continue to do well, and thankfully, that clinical course is mild and really self-limited. The other component around this pandemic we've seen, and we've all heard about Kawasaki disease or multi-system inflammatory syndrome. The good news with that is we've seen all kids thus far here at Nicholas Children's have had an excellent outcome. Again, I would like to close again by thanking and asking everyone to do the things that we've been talking about here today. Wearing masks, physical distancing, hand hygiene, all those are important, not only for us, but for our patients, our caregivers, and our community. Thank you.
Thank you. Next, from Mount Sinai Medical Center, we'll hear from their president and CEO, Steven Sonnenreich. Is President Sonnenreich on? Oh, I think you are muted.
There we go. Thank you and good afternoon, everyone. And thank you, Mayor, for gathering all this leadership, and thanks to all the elected officials and to my colleagues for all their participation and support. I want to echo everything that has been said. I also want to thank the Mayor for her forthcoming campaign of hope. And part of that campaign, I know, which focuses on everything that's already been discussed and also the vaccine, something that may have been maybe able to be emphasized further are the wonderful outpatient treatments and therapeutics. We tend to look at treatment being on the inpatient hospital side, and statistics, as you've heard today earlier, focus on inpatient utilization. I would just like to defer my remaining time to Dr. Robert Goldzer, who's our Chief Medical Officer, to talk about the wonderful outpatient therapeutics that are available here at Mount Sinai, and I know at other institutions around the community.
Thank you, Steve. Thank you all. So we've all been dedicated, particularly Mount Sinai, we've been dedicated to providing the most up-to-date therapies as we've gone along through the pandemic by identifying the treatment that will benefit each patient in a specific way. And the goal really has been to provide that appropriate care in the best setting to achieve the best outcome for each of our patients. There's various treatment options available, both outpatient and inpatient now, which we should be emphasizing and should be making sure patients are aware of, and they are meant for our high-risk patients. Outpatient therapy, we've heard a little bit about monoclonal antibody therapies. There's 2 available now. It's an IV infusion to help the immune function, minimizes the chance of hospitalization. And so that's a wonderful new therapy that's available. Physicians need to be in touch with their patients. Patients need to know about this, to ask about it, to make sure they meet the right qualifications to be those high-risk patients, that those with certain comorbidities, kidney disease, diabetes, immunosuppressive disease, those over age 65 fall into that category. For those patients over 55, as a reminder, they must be over 55 plus a comorbidity, heart disease, hypertension, COPD. Inpatient, we've also done a lot better, as you've heard about, with remdesivir. It's a antiviral medication. It reduces the ability. We were one of the first studies. Many of the people on the call were involved in early trials, and then be able to get the medicine available now for our patients. Steroids is the other thing, the dexamethasone that people are using in patients to really try to decrease ICU and decrease mortalities. We continue to stay up to date with latest developments in treatment, constantly assessing what's new. And we've learned, and I know this is true from the other centers on the hospital, that the key thing has been the focus on highly attentive care, paying close attention to the changes in each patient, a testimonial to the doctors, the nurses, the technicians, and staff that have been caring for these patients, and the teamwork to provide the right PPE for those workers and people that are on the front lines. So thank you for all that.
Thank you very much.
Great, thanks to you both. Next, we'll hear from Florida Medical Center and Miami-Dade Group Tenant CEO, Jeff Welch. Do we still have Jeff on the call? All right, we'll skip over for now and see if he's still on. Next is Memorial Healthcare System CEO, Aurelio Fernandez.
Thank you. And thank you, Mayor, for getting involved with this pandemic crisis that we have in just less than a month after you got elected to this role. It is really critical for all of us to understand what we're facing. And a lot has been said about what to do moving forward. But I wanted to bring up a level of reality of what the healthcare industry faced in August and July and August, because the surge that took place then cannot take place again. The resources are not there. We can convert rooms overnight, but there are not enough nurses, there are not enough clinicians, there are not enough respiratory therapists out there. There's a shortage. And what we need to understand in the public is that just having a nurse doesn't mean that you have a nurse. A critical care nurse is not the same as a telemetry nurse or it's the same as an emergency room nurse. Each one has certain skill sets that are not transferable unless you learn. So that reduces the pool of nurses in the local market. In addition, we are being faced that they're recruiting nurses from our market to go elsewhere as travelers. I know that Baptist Health has been hit with it. I know that Broward Health has been hit with recruitment efforts, and that decreases the pool of nurses here. The fact that other parts of the United States have seen surges has also redirected traveling nurses that used to be available back in July and August that they're no longer available. So it's not like we don't have beds. The beds are there. But the critical point here is that there are not enough clinicians and nurses. The public needs to know that a nurse has a 12-hour shift in front of a patient, and they're suited up with PPEs for 12 hours. They work 1, 2, 3 shifts a week. Then they're asked to work 4th and 5th shifts a week. That is extremely stressful. And you can only take that for so long. We've been in this war for now 9 months. And I don't think the system can withstand another 2 to 3 months. And all of us in this call as healthcare providers are seeing an increase in the number of patients being admitted to our hospitals. I asked the elected officials who are here to engage the community, business leaders, to be able to understand the crisis that we face if this thing is not put under control. I also want to address the situation with the vaccine that Jackson Memorial has. For the last 2 days, we've been working with the Agency for Healthcare Administration on how we can redistribute some of the vaccines that were not consumed by each one of our facilities and shared with our sister hospitals. Each one of it, Jackson Memorial has identified 5 hospitals and 5 healthcare systems. I have done the same in Broward and will do the same in Palm Beach in order to spread the ability of us to share in having the vaccine available to the staff. The first line that will be eligible for the vaccine are healthcare workers in hospitals. The nursing home and long-term care are going to be taken care of by CVS and Walgreens. It's going to be a long process. This is not going to be overnight, but at least there's light at the end of the tunnel. Let's just be patient, adhere to the wearing of masks and physical distancing. So I asked elected officials in this call that we work together with the business community to be able to at least have the public, when they enter the establishments, to wear masks and honor the CDC guidelines that I believe is the only thing we have right now to prevent this thing from surging even higher. Thank you very much for the opportunity to share my thoughts.
Thank you. And last but definitely not least, our final speaker is Broward Health Chief of Emergency Medicine, Dr. Evan Boyer.
Thank you. Greetings. It's an honor to speak to this distinguished panel. And I certainly echo everybody's comments to this date, and I wish Dr. Mayor Levine Cava a speedy recovery. First and foremost, I want to thank our community leaders for this support through the pandemic. And then my comments actually might put a little additional spin on what we've been actually facing. So if you back up a number of months, the EDs have been ground zero. Broward Health as long included in all the other South Florida health systems. And, you know, in the beginning, there was a lot of uncertainty. There was no widespread testing, and patients came to the emergency department. And we essentially learned about the disease as the pandemic progressed. And we learned that it's not just necessarily a flu-like illness or respiratory illness, that you could have increased chance of strokes, heart attacks, because there was a hypercoagulable state secondary to that. So kind of the concerns now that we've learned about the disease, and at Broward Health, we share the same armamentarium of treatments in outpatient, inpatient, currently we have about 80 patients in-house, and we have strong capacity. But there's other concerns where you would think during a pandemic that your volume would go through the roof. Volume is actually decreased in the health systems, and we've seen critically ill volumes spike. And there's a fear in the community. Patients are staying home. We took a look sometime in May or June at the ED volumes and our fire rescue volumes, and they were both down significantly. And we found that our 911 calls were down significantly. And we found that the number of dead on scene when 911 got there was about 20%, which was markedly higher. So you have this kind of difficult situation where patients are getting sick at home, actually dying at home, versus coming to a hospital where there's actually low risk of actually COVID exposure in the hospital. And that trend continues. So you see more patients foregoing health screenings, annual visits, routine care. Cancer diagnoses are down about 40%. And let's be clear, there's not 40% less cancer, just the diagnoses are down about 40%. So late presentations of all disease processes creates a problem. Now, we've learned so much about COVID-19 over the past few months in our health system. We have multiple safety measures in place with masking, physical distancing, and other safety measures to keep the hospital safe. And those are the same things that we implore the community to do. But, you know, we need further help sharing with the community and influencing the public to return for maintenance care and screenings. You know, without resuming these annual screenings and maintenance care and early presentations, we could face a kind of different pandemic, if you will, of presentations of later diagnoses. So, you know, clearly everything that everybody stated, I agree. Things that we can do to make things to help with prevention. We have to continue to encourage our community to do so. And once again, you know, I want to thank our community leaders for the support over these past few months, and I appreciate the opportunity to join your call.
Great, thank you. So we now have a few minutes to take some questions from media. So please just put your hands up in the Zoom if you have a question, and we'll try to get to you if we can. First up, we have a question from Doug Hanks from the Herald.
Sorry. Hi there. Mayor, so we haven't seen any action from you on COVID. We've got a messaging plan. Is there action you want to take for COVID that you're unable to because of Governor DeSantis? And if you could get him on the phone, what would you ask him to allow you to do? Because we're hearing alarming comments from hospitals. Commissioner Sosa said that she thinks there should be more regulations. What is it that you want to do as we face this big spike?
Well, thank you, Doug. We have enlisted the support of the cities, and we are going to be enforcing the masking and curfew diligently. That has already begun, so that we'll not have a situation where there will be partying or clubbing going on after midnight. Also, the police department in the county is now distributing masks as well as enforcing the masking order with citations where necessary. So these are the tools that we have in our toolbox right now that we're utilizing. In the meantime, an appeal to the governor has been that if cases continue high with high positivity, that local control be granted. and we're going to renew that through the League of Cities together with my office.
Still made to the governor?
Correct.
Is that a letter or how is that made?
Yes, we talked about it earlier today, and we'll be putting something together. We're obviously watching the positivity rate very closely. It is my great hope and belief, and together with the mayors and the business community as well, that we'll be able to tamp down on the growing positivity rate if we do unify. Look, messaging is very important because the public has been confused, and there have been different messages, different messengers. This hospital capacity issue means that our entire healthcare system is speaking with one voice. We have, again, all the cities stepping up, recognizing that there will be uniformity in the way we handle these cases, and all of those things will make a difference.
Great, thanks, Mayor. We have a bunch of questions, so I'm going to keep going through the list. Adriana Delgado has a question.
Yes, I would like to preguntarle al presidente Aurelio Fernández. Sí, quisiera hablar, él dio unas declaraciones en inglés, me gustaría ver si puede dar las mismas declaraciones, pero en español.
Bueno, mi español no es tan bueno como el de Carlos, pero lo que yo estaba tratando de hacer es educar a la comunidad que la crisis que nosotros tuvimos en julio y en agosto no puede pasar otra vez en diciembre, especialmente cuando están las fiestas y que todo el mundo viene y no siguen los guidelines que tenemos que seguir con usar las máscaras y esas cosas. No hay suficientes enfermeras para poder cuidar a los pacientes que tuvimos que cuidar en julio y agosto. ¿Por qué? Porque nosotros trajimos enfermeras de afuera del sur de la Florida. Esta organización, la mía, trajimos más de 300 enfermeras. Esas enfermeras ahora se están trabajando en Chicago, Illinois, en Iowa, en otras partes de los Estados Unidos. Entonces ya eso no existe. Y lo que está pasando es que estas compañías que usan las enfermeras de afuera están viniendo al mercado del sur de la Florida y están tratando de reclutar a las enfermeras de aquí para llevarlas a otros lugares. Lo que pasa entonces es que eso reduce el número de enfermeras y de respiratory therapists que hay en el mercado para cuidar a estos pacientes. No es la cosa que hay camas, porque nosotros tenemos camas y cuartos para cuidar a los pacientes, es el personal que hace falta. Y la única forma que podemos evitar que no pase lo que pasó en julio y agosto es usar las máscaras y también las distancias que tenemos que tener. Y eso lo tiene que también la comunidad de negocio tiene que supervisar esos consumidores que van a sus establecimientos para ir a comer o ir de compras de tienda, que no pueden entrar si no tienen una máscara. La otra cosa que lo dije en inglés es que Jackson Memorial y Memorial Healthcare System vamos a recibir la vacuna de Pfizer. Vamos a tener suficiente no solamente para los empleados de estas dos organizaciones, pero vamos invitar a otros hospitales en la área para poder ofrecerle la vacuna a esos hospitales. Y ya eso se ha hecho. Esta tarde vamos a mandar los nombres de esas instituciones que van a estar invitados a participar con el vaccine. Jackson tiene los hospitales en Miami-Dade y Memorial Healthcare tiene los hospitales en Broward County. Yo he hablado con los presidentes de los hospitales que van a ir y todo el mundo entiende cómo es que pueden participar.
Perfecto. Su español es muy bueno, así que no se preocupe. Gracias.
¿Qué cree, señora?
Para ser un cubano de Broward habla bastante bien, ¿verdad?
Habla muy bien.
Thank you. Next, we have a question from Amy Viteri.
Hello. Okay, am I unmuted?
Yes, you are.
Okay, so this question could be for Mayor Levine Cava or perhaps Mr. Migoya, depending on who would like to take it. Given the fact that we are likely looking at a couple of more months of hardship, seeing as how the vaccine, if we're talking general public, likely won't be making an impact for several months. Are we concerned going into the holiday season that there is no longer a field hospital available like the one that we used to have in Miami Beach? Just how big of a crunch on resources could this be in the coming months with people, many of whom will not follow the guidance of not traveling for the holidays? What can you tell us about how prepared we are for how difficult these next couple of months may be, whether it's beds or staffing?
Madam Mayor, if I may, the challenge, and I think Aurelio did that both in Spanish and English, the biggest challenge that we have is staffing. We no longer have the availability of the temporary agencies, and as a matter of fact, many of our own people are being recruited by temporary agencies throughout the country at a much higher rate. So that is the challenge. The temporary, those Army hospitals would only have worked if we had additional staff. We were lucky enough in July to have enough staff that we were able to hire temporary agencies with the help of the state. Governor DeSantis provided millions of dollars in support of a temporary agency to all of us to help us with those people. That is not available right now. The challenge that we have is exactly what you're saying. We're expecting the numbers to continue to climb. Remember that the infection happens a couple of weeks after the contact, so therefore we're expecting Thanksgiving contact to really make those numbers climb over the next couple of weeks, and then right after that, of course, we have the holidays of December, so that's going to be challenging. We think that these numbers will continue to rise even into January. So, and that's part of the reason why we're doing this conference, and Mayor Cava volunteered to do this, because I think it's important for everybody to understand that we have at least 30 to 45 days of challenging times ahead of us, and we cannot afford to get to the kinds of numbers we had in South Florida back in July, because we even though we have the beds, we may not necessarily have the staff. So we need to make sure that businesses and the community stay in social distancing and masking as best possible. And to Mayor Cava's point about the curfew, extremely important that we also uphold the curfew to make sure people stay at home and do not spread the disease at this point in time.
Is maintaining staffing or getting additional staffing an option that the state is looking at, or that we at the county level can look at this point? Just as a quick follow-up.
The state did that before. I mentioned in this, and I'll mention again, there is not additional temporary agency available at this point in time. The difference between now and the summer, in the summer there were specific markets in the country that had high surges. Now the entire country is going through these high surges, so those temporary agencies are being utilized throughout the entire country. So we will not have those kind of additional staffing. So we have to do with what we have today.
So this is exactly why we are holding this event today, to make sure that the public understands we are up against the wall here. And given the what we have in our toolbox, we must have full cooperation with all of the precautions that we know work. We are not universally masking in our community today. We are not universally adhering to the curfew. We are not taking full advantage of our testing capacity, which is very significant. We're not utilizing all the isolation rooms that we have at our disposal. So we are not utilizing the contact tracing. We have a low rate of participation in contact tracing. So these are the tools that we have available to us. And if we speak forcefully with your help to communicate that to the public will help us bring these numbers down.
Thank you.
Great, so we're a little bit over time. We're going to keep going for a few more questions. If folks are able to stay on, that's great, understanding that some people might have to jump off. So next we'll go to Emmanuel Villalobos with a question.
Thank you, Rachel. This question will be in Spanish. La pregunta es en relación a unas declaraciones que dio Rebeca Sosa hace minutos. Decía que mantener los comercios era importante, pero que si los casos seguían incrementándose en el condado, pues tendrían que tomar medidas más rudas. Me gustaría saber si acá en el condado Miami-Dade, pues un nuevo cierre económico es una alternativa, a pesar de que el gobernador no comparte esta alternativa para luchar contra el COVID-19, y en caso de que sea afirmativa, que sea una propuesta, ¿en cuánto tendrían que estar los números para que realmente sea una opción?
Bueno, yo voy a tratar de contestar primero, decir que lo único que tenemos ahora es de las máscaras, que no podemos colectar las multas, pero podemos dar citaciones cívicas, y también ese toque de queda, el toque de eso. Y tenemos ahora hasta medianoche, y esperamos que podemos seguir así. Pero eso depende en lo que hacen nuestra gente. Y por eso estamos pidiendo toda la ayuda del público para participar con los negocios, los negociantes que también mandan la misma información a los clientes, y vamos a usar nuestra campaña para levantar los que están haciéndolo, para tener como actividad buenas que podemos levantar al público para ver que es posible y que eso ayuda.
Muchas gracias, alcaldesa.
Thanks. Next question from Tony Pipitoni. If you're still on. You might be muted. We can't hear you. Can we go quickly to Ben from the Herald, and we'll come back to Tony?
Can you hear me?
We hear you.
Hey, thanks. Yeah, I just wanted to follow up on a question that my colleague Doug Hanks asked, I believe, last week about Governor DeSantis and whether he's reached out to you, Mayor Levine Cava, and if you've had any communication from the governor's office since that last time we asked.
We have, my office has reached out, and we have had a communication with a member of the governor's staff, and but I have not personally had the opportunity to speak to the governor at this time.
Thank you, and I hope you feel better soon.
Thank you.
We'll try for Tony's question again. Tony, are you unmuted? We can't hear you, unfortunately. All right, I think we can do one more question from Veronica Zaragovia, if you're still there.
I am, and thank you. And Mayor, I wanted to ask you if you could elaborate a bit on the messaging that will be coming out. Is it a different tactic, like maybe going door to door? Kind of what should we expect to see? And if there's any tailoring towards our residents who are Black and Latino, or how are you, is this messaging just more tailored to specific people or to everybody? If you can elaborate.
Very good. Well, I don't know if we're quite ready to give the name of the campaign, but deference to Rachel. Are we okay with that, Rachel?
Sure, you can share the name of the campaign.
Okay, so the English version is we can, we will, and we can adapt, and we will thrive. And it's very Miami. It's very social media, digital media oriented. There'll be a Spanish and Creole version as well. And the idea is to lift up people who are doing the things that we need them to do, to mask, to contact trace, to spend their time outdoors during the holidays, etc. And so it's meant to go viral, and it's meant to appeal, let's say, to young people, to people who utilize those platforms for communication, and to get to those populations that have been somewhat more resistant to follow the guidance.
Thank you.
Thank you.
Great. Thanks so much to everybody for staying on a bit late. Thanks again to everybody for joining us, all the leaders who are here.
And I just want to add as well, this is really, to me, extraordinary that we are working across the region, that the healthcare leadership is aligned, that they've come together in this crisis, speaking with one voice, and we're here to amplify your appeal to the public to take into account not just the overall need to prevent the pandemic from spreading, but to protect our vital frontline healthcare workers. So thank you everyone for joining us today.
And before we finish, we have our Creole translation. So whoever can stay on to listen to the Creole translation will help us close out. Thanks so much, Mayor.
Thank you.
Excuse me, Rachel, I've had my hand raised for 20 minutes now. I was never called on.
Okay, would you like to ask a quick question?
Yes, I'm Andy Slater from Fox Sports 640 South Florida. My question is for Mayor Levine Cava. The Miami Heat season is beginning in about 3 weeks from now. And as you know, the governor has said that all stadiums and arenas could be filled to capacity. So do you have a recommendation for the Miami Heat? And have you spoken to them at all about what their plan may be?
Well, thank you for the question, and I'm sorry that we kept you till last, but I'm happy to report that yes, in fact, I have been in communication with the Miami Heat, and we're assisting them to come up with a plan.
Do you expect that there will be fans in the stands at the beginning of the year?
You know, we need to ask them specifically, but we are working with them on something that will be both responsible and allow the game to go on. So hopefully you'll see some opportunity for sports to go on. And by the way, our Chief Medical Officer, Dr. Page, who's with us as well, has been part of the conversation. So just so you know, this is one of the great things that we bring in having a Chief Medical Officer is that we are able to communicate with our business community and come up with win-win solutions. I'm sorry, I can't be more specific because I don't have the answer right now. What is exactly the plan?
Great. Thank you, Mayor.
Tenía una pregunta para el señor Migoya en español, también tiene la mano levantada. Es muy corta, nada más, para que nos diga básicamente...
Super quick.
Sí, de que nos diga el señor Migoya cuál es la capacidad que tiene a este momento el Jackson Memorial. Y se habla de 200,000 dosis que se van a dar justamente sobre la vacuna. ¿Tienen un número específico del número de personas que le van a dar la vacuna y que ellos dicen que va a ser a final de diciembre, que esto ya va a estar terminado?
Los estimados que tenemos, primero que nada, en la vacuna, los estimados que tenemos que vamos a recibir en Miami-Dade para los empleados de hospitales son de 20,000 dosis. Esa es la primera, o sea, 20,000 empleados vamos a poder darle y después va a una segunda dosis en 3 semanas de 20,000 para darle la segunda dosis. Lo que es capacidad de camas en este momento, en Miami-Dade County estamos sobre 850 pacientes en este momento que están con COVID. En julio llegamos a un máximo de 2,300. Como mencioné anteriormente, en aquel momento teníamos mucho personal temporario que habíamos recibido. No creemos que podemos llegar a nivel nada como ese. Todavía tenemos habilidad de poder sostener un poco más grande el número de pacientes, pero no a los niveles que tenemos en el verano. Y por esa razón tenemos que estar siguiendo el cuidado que tenemos en este momento de la distancia social y las mascarillas.
Great, thank you. And now we'll close out with the Creole translation.
Thank you very much. Ici, département communication, côté Miami-Dade, nous parlons pour déclaration maire Daniella Levine Cava, soit fait dans la langue espagnole avec anglais. Nous parlons pour en créole. Quand le coronavirus a monté en pile et nous devons faire attention très sérieusement avec ça. C'est pour ça que nous réunissons ensemble comme leaders qui sont dans tout coin dans côté Miami-Dade et dans toute sud Floride là pour nous parler avec la communauté noire. Nous avons un pile inquiétude sur la quantité de cas qui a monté, qui a mis un pile tête chargée sur le système de soins santé noir et qui a pris soin patients COVID-19. Nous avons un pile inquiétude tout parce que semblait jour qui est plus difficile devant nous toujours et ça c'est un bagage qui est tellement important pour nous continuer à suivre mesures qui fait preuve déjà pour diminuer la propagation du virus là. Mettez un masque, couvrez bouche nous à toutes nous et chaque fois que nous sortis aller en public. Pratiquez bon gens hygiène main, lavez main nous avec de l'eau, avec savon, avec désinfectant pour main. Pratiquez distance physique, ça veut dire rester à 6 pieds au moins une par rapport à l'autre lorsque nous sommes en public. Évitez foule l'autre monde avec gros rassemblement et puis si ou bon côté l'autre monde, tant pis faire réunion ça dehors, faire rencontre dehors. Population qui a un pire risque quand pour grand monde qui est âgé avec monde qui a des maladies qui existent déjà, doit spécialement faire attention pour limiter l'interaction avec l'autre monde autant que possible et pour ne pas arrêter du tout côté monde qui n'a pas de masque. Puis bon, bagage nous avons fait pendant la période de saison fête là, c'est renvoyer tout voyage et puis rester la caille. Mais si on décide de voyager en dépit de avertissement CDC Bayo, l'agence l'a recommandé aux gens qui a voyagé faire test COVID-19 avant et après voyage. Recommandation, c'est pour être capable de faire un test avant voyage, un à 3 jours avant voyage là, et un test après voyage, 3 à 5 jours après voyage là. En plus, pour être capable de diminuer l'activité essentielle pendant 7 jours après voyage là. Les gens qui n'ont pas fait test doivent diminuer l'activité qui n'est pas essentielle pendant 10 jours après voyage. Si un monde ou faire un test qui est positif, tant pis, pas voyager sous aucune circonstance. Vraiment important pour nous comprendre, et spécialement la population qui est jeune, capable de souffrir avec COVID-19 sans que pas manifester aucun symptôme. Et ça, c'est un bagage qui est dangereux, et spécialement pour les gens qui vivent à Miami, côté en pile monde qui a plusieurs générations à vivre dans le même cas. Côté Miami-Dade, il y a plusieurs côtés, on est capable de faire test COVID-19 gratis et on est capable de bien résultat dans 24 à 48 heures. Donc, c'est un avantage pour nous utiliser les ressources qui sont disponibles déjà. Nous vraiment besoin public, la fait partie par là, pour être capable d'aider les communautés noires, suspendre la propagation du virus. Vaccin en route, c'est une bonne nouvelle, mais nous avons besoin qu'on ait que le vaccin n'a pas venir rapidement résoudre le problème de la pandémie en bout de secours. Vaccin Pfizer, il a besoin de 2 doses pendant 3 semaines. Après ça, il a besoin de 2 semaines à peu près pour être capable de développer l'immunité. En printemps, le grand public là capable de gagner accès à la première dose. Masque, hygiène main, distance sociale, c'est absolument important pour la protection de nous. Si vous voulez honorer infirmiers, docteurs avec tout héros dans la santé, tant pis respectez le règlement ça pour un petit temps encore. Patience. Nous avons besoin de tout le monde jusqu'à la fin. Merci.
Thank you so much. And thanks again to everyone for joining us.